about their well-being.
So while Texas prepares a statewide response, in North Texas, first responders are practicing what will happen if there is a local outbreak.
And they say they have protocols in place and they're prepared for any level of outbreak. Fox 4's Natalie Solis joining us with the story. Natalie.
Well, Heather, as you might imagine, there is a lot of coordinating going on behind the scenes. The goal to make sure cases are caught as soon as possible and protect the first responders who will likely be in close contact with possible coronavirus patients.
The phrase of the day is preparation, not panic.
Fort Worth first responders in prep mode as new coronavirus cases surface in the United States. The screening process starts when patients call 911.
So the main questions we ask are risk of exposure.
Patients asked if they've traveled to mainland China or places where COVID-19 is an epidemic, or if they've had close contact with a suspected COVID-19 patient.
Right now it's mainland China. As other countries develop epidemics, we would add those questionnaires. If a patient screens positive, it immediately notifies responding fire and EMS personnel.
That triggers specific protocols for protective gear beyond what's normally worn for common cold or flu.
The problem with COVID-19 is we use airborne precautions because there's some concern that the virus is small enough to be outside of droplets. So we take one step higher level of protection.
That means a basic surgical mask will be placed on the patient as usual. But with a suspected case of COVID-19, first responders will wear added protection, including a higher grade N95 face mask, able to filter out the tiny particles of the virus.
This is our actual airborne isolation precaution mask. So our first responders would be wearing this.
They'll also wear a plastic gown and slippers as well as an eye shield. If it's a suspected case, the county health department would be notified and the patient would go to the hospital under isolation precautions. Fort Worth firefighters follow the same protocols and assure residents while the response may look a little different, the quality of care remains the same.
It does not matter what your symptoms are. It does not matter what your sicknesses are. You're going to get the same professional care from Fort Worth firefighters, from MedStar paramedics, no matter what. And that's what we're there for.
And we've just learned the list of countries 911 dispatch will be screening for, in addition to China, now includes Iran, Italy, Japan, and South Korea. MedStar says the public health department is aware of anyone who has a known or potentially known exposure to COVID-19, and those cases are logged into the EMS dispatch system in case first responders get a call from one of those homes. They say the sooner they have information, the better. Stephen, Heather.
Okay, Natalie, thank you.